do a little experiment. I need 2 volunteers. Okay. Brittany, you volunteering, by the way? Okay, I didn't. Brittany, come on up. And who was the other volunteer? Okay, Sarah. Okay, wait.
Yeah,
Kat, will you volunteer?
Let Kat do
All right,
it.
come on. All right.
That's why I put my hand down. Kat,
Here's what we're going to do. We're going to simulate asthma, okay? The way we're going to do this...
Kat has asthma.
Okay. Are you guys want to have asthma? Well, let's take the 2 people who don't have asthma then. Because you know what asthma's like already. So the way we're going to do this is control your passageway so that air only moves out of your mouth, in and out of your mouth. So put this little clip on your nose. Okay? Now, that's a little bit uncomfortable, but you can still breathe freely. Now, what I want you to do is wrap your lips around this little straw and only breathe through the straw. This would represent narrowed airways. Okay? And that rest in the beginning, you might be okay. But now we're going to walk a little bit. Okay?
I have my asthma pump just in case.
Come on down this way. Just breathe through the straw.
So if I,
Yeah.
shape.
Just
I don't know.
You were fine at practice the other day.
Was I though?
Okay. You can go ahead and take them out. Tell me, what does that feel like?
Awful. Yeah, that wasn't nice.
It's, and that's how a child feels with athlete throws away. Is that when you can't move air, you start to feel a little bit panicky. Okay? You can feel the struggle that's occurring inside. Okay, you're starting to use accessory muscles. I think you have good accessory muscles. I think we've done this before. I want you to turn with, I'm just tucking your shoulder just to move like this. Okay, that's it. All right, I want you to pick your chin up just a little bit and take a deep breath. Deep, deep, deep. Okay, you see what happens when she takes a deep breath? She's flaring the sternocleidomastoid. She's contracting the sternocleidomastoid, and as a result, she moves more air. Thank you. By the way, the same thing happens when you exercise. If you start running, you need to move more air in, so you start using accessory muscles. Okay, you create higher pressure gradients. All right. So, what do we do when a child comes in with asthma? What type of medicine do we give them? Albuterol, right, it's a bronchodilator. Do you know how albuterol works?
Yeah.
It does, how does it work?
Well, it makes you breathe.
Right,
but
but-
it like dilates.
It binds to what type of receptors on the airway?
Is it beta 2?
Beta-2 adrenergic receptors. You know, the adrenergic receptors are the ones that interact with the sympathetic nervous system. Those sympathetic nerve fibers to the airways release norepinephrine. So, if an autonomic fiber releases norepinephrine, it's called an adrenergic fiber. Okay? And that norepinephrine is going to bind to an adrenergic receptor along the surface of the airways. It happens that the subtype is beta-2. These are beta-2 adrenergic receptors. And so we would call albuterol a beta-2 adrenergic agonist. It binds to and stimulates or activates beta-2 receptors. Okay? And once you open up the airway, you reduce resistance. That makes airflow easier. It's like removing that little straw from your mouth. Now, we mentioned this the other day. A second factor that impacts airflow is alveolar surface tension. You know that the airways branch repeatedly, one generation after another, until ultimately, at the end of the airways, you have these little air sacs called alveoli. And each of these alveoli is coated with alveolar fluid. Okay. This alveolar fluid that coats the inside of the alveoli is made up mostly of water. And you learn from AMP1 that water is a very polar molecule. It's got a positive end, a negative end, and these opposite ends of adjacent molecules attract each other. And so water molecules hold tight to each other. They tend to become compressed. They tend to bead up, take up the least space possible. Okay? When that occurs within the alveolus has a tendency to collapse. And they would collapse if it were not for surfactant. Surfactant is that detergent-like substance. It's a lipoprotein created by type 2 alveolar cells. And the role of the surfactant is to decrease that force of attractiveness between water molecules. Okay? So that the alveolus has less of a tendency to collapse. It's easier to expand the lungs. Okay? We talked about last class in a condition called infant respiratory distress syndrome, in which premature infants are unable to produce enough surfactant to keep their alveoli inflated between breaths. So that, again, during expiration, when intraalveolar pressure is at its lowest, there's the least amount of pressure tending to stent open the airways and alveoli, the alveoli tend to collapse. And so then the infant struggles then to reopen the alveoli with each breath. Okay? So oftentimes if the child is too premature, they end up on a ventilator to assist with that. So that's the second factor that impacts ventilation. The third factor is lung compliance. When I think of compliance, I simply think of the term stretchability. Stretchability. Does somebody have a rubber band?
I do.
Can I borrow your rubber band?
Hold on, I have to find them first.
You're very well organized. I like that. Okay. All right. Thank you. All right. I have two different rubber bands here. One is thicker than the other. Okay? One is tighter. It doesn't expand as easily as the other one, which is thinner. Okay? So we would say that this rubber band is more compliant than this one. Okay? Now, when we talk about compliance in relationship to the lungs, a lung that exhibits greater compliance is more easily expandable or stretchable. Okay? So it refers to the ease with which we expand the lungs. If a lung exhibits decreased compliance, then we have to use more energy to try to expand the lungs. Thank you so much.
You could keep it if you want.
Yeah, I can use this for next class, next semester. All right. So, one common factor that impacts compliance is formation of scar tissue. Give you an example. Tuberculosis is a fairly severe infection that can spread to different parts of the lungs. Okay? And typically, tuberculosis can trigger a fairly severe inflammatory reaction, which, as it evolves, leads to scar formation. So because it can spread to different parts of the lungs, and it can lead to scar formation, as a result of a severe episode of tuberculosis, you may be left with a less compliant lung. Okay? Because what you're doing is replacing elastic fibers with scar tissue, which are What type of fibers? Scar tissue is made up of collagen fibers. Yeah. So collagen fibers don't expand. They provide strength, but they don't expand like elastic fibers do. So that would be an example of someone who may have decreased compliance. Or I'll give you another example. You ever hear of the occupational lung disease called silicosis? Silicosis occurs in people who are sandblasters. Every several years, you'll see sandblasters on the Crescent City Connection. Okay? And what they do is they're blasting the bridge with these very, very fine particles of silica, okay, that remove the rust on the surface, okay, to allow them to repaint the bridge. Okay? And these sandblasters are supposed to wear this kind of hazmat uniform with a big old hood, okay, that filters incoming air. The problem is that oftentimes they're sandblasting in the summer, and these outfits are very, very hot to work in all day. So what do? They remove the hood, okay? The problem is that these tiny particles of silica are so tiny that they escape filtration. Now, some of them do get trapped on the mucous membrane and get removed by the mucociliary escalator, but many of them make their way all the way down to the alveoli, where they create an inflammatory response, you know, particularly over time, over years. So if someone's been working as a sandblaster, over time, that they can develop a condition called silicosis, where these tiny particles of silica have led to widespread inflammation and scarring. And so their lungs now are less compliant. They have a harder time with ventilation. They can get to the point where they're short of breath with very little physical activity because they can't expand their lungs. That's an example of compliance, decreased compliance. Some people develop decreased compliance as a result of arthritis of the rib cage. Okay? You know, arthritic joints are less movable. You know, it not only hurts, but they have restricted range of motion. So people who have arthritis of where the ribs connect to the vertebrae, and then when they connect to the sternum, those are all joints. And so they may have more difficulty expanding the thorax to move air. Well, that would be another example of decreased compliance. Even decreased production of surfactant, in a sense, impacts compliance. So compliance is yet another factor that can affect ventilation.
Would age have anything to do with lung compliance?
Yeah, as we get older, we tend to have decreased lung compliance. Okay, but usually not to the point where it's pathological. But if you would just do pulmonary function test, you can tell that someone has less air movement, that they don't expand their lungs as easily. Okay, so that brings us to the topic of pulmonary function test. Let's suppose a patient is complaining of shortness of breath. There are lots of different causes for shortness of breath. Somebody could be short of breath on the basis of congestive heart failure, where because their heart fails as a pump, fluid backs up into the pulmonary capillaries, it extravasates, and so you develop edema within the lungs. Well, that would cause shortness of breath. Or you can have shortness of breath on the basis of anemia. You know, you just don't have the oxygen carrying capacity. Or certainly you can have shortness of breath on the basis of pulmonary disease. The point is that there are lots of different organ systems which, if they malfunction, can lead to shortness of breath. So one way of trying to narrow down the cause of the shortness of breath, okay, specifically if you're considering that it's perhaps pulmonary in etiology, is to do a pulmonary function test. The machine that's used to perform pulmonary function test is called a spirometer. Spirometer. Okay. Now this is the old-fashioned spirometer here. The devices we use nowadays are all electronic, but the principle's the same. You put a little clip on your nose so that all air moves into and out of your lungs through your mouth. And then you have the person wrap their lips around a tube that then enters the machine and can measure not only air volumes, but airflow. Okay? So this is called a spirometer. And for instance, one of the measurements that you would obtain when you first connect the patient is what's called tidal volume. Tidal volume is simply the volume of air that moves into and out of your lungs during quiet breathing. So let's put volume here on the y-axis, okay, and time be along the x-axis. Okay, so let's say this is 1 liter, 2 liters, 3 liters, 4 liters, 5 liters. Okay. When you connect a person like that to a spirometer, okay, the machine is going to have a little cursor which moves up and down to depict the amount of air that's coming into and out of the lungs. As you inspire, the cursor moves up. As you expire air, it moves down. So with each breath, the cursor moves up and then down, reflecting the volume of air that's either entering the lungs or leaving the lungs. Okay? So you can look at this difference here. Okay, let's say this is not quite a liter, this is about 600 milliliters. Okay, we would call that volume of air that moves into and out of the lungs during quiet breathing, we would call that tidal volume. So this measurement here would simply be tidal volume.
Do they connect you to a spirometer whenever you ride in an ambulance?
No.
You know, they have sometimes they'll have, with an ambulance report, they'll have the EKG, but also a respiratory,
Like a mask?
a respiration reading.